Hi everybody, my name is Jason Jimenez with Jason Jimenez Insurance Agency. I want to take this opportunity to say thank you very much for the opportunity to provide you your medical benefits package for 2011. It is very important that the communication between our agency and MyFit Foods is continuing and ongoing. And in saying that, I want to definitely direct you to the website myfitfoods.com. myfitfoodsbenefits.com. And if you look on the left-hand side, you'll see a icon that says downloads. When you are eligible for your medical benefits, medical, dental, vision, supplementary products, you can click on there and it will print you out, and you can download or print out all the documentation that you'll need to fill out and submit to your either HR department, or on the website it directs you to an email or an e-fax that you can submit the documentations to, so that we can properly enroll you. It is very important that you understand also that we also are dedicated and make sure that we educate you. That's the biggest part. I mean, we want you to be able to understand how to be able to utilize your plan. It has cost-saving strategies in relation to medical bills, or in addition to, for example, prescription drugs. No questions too dumb or too small. That's what we're here for. What I'll also do is I'd also like you to go ahead and look on the top right-hand side of the website, and it says added value services. This is a link that is going to be provided to you in the up and coming months, where you, as being an employee of MyFit Foods, is going to give you the capabilities of giving added value services, like local businesses that we've aligned ourselves with, to be able to provide you discounts or services specifically for MyFit Foods. So I'll go ahead and introduce you to Houston Hamilton. He is our benefits enrollment for our Colonial and benefits side. So, Houston.
Hi everybody, Houston Hamilton. I work with Jason as part of the MyFit Foods benefits team. And some of the things I'm going to be talking about a little bit later on are your dental coverage options, vision, and some supplemental benefit options that we've made available in the package to you. I'll give you an outline of how those work, why they might be important to take a look at, and also walk you through some of the paperwork in terms of how to get enrolled in those if you think that they would be of benefit to you. So I'll be talking with you a little bit later.
Very well. Well, let's go ahead and get started, and we'll start with the medical benefits and go into details and hopefully answer some of the questions you may have. Hello everybody. On this particular slide, we're going to be talking about the medical plan on your 2011 benefits package. Your medical plan is being provided to you by Great West Healthcare, which is basically a company that is owned and operated through Cigna. It is important that you know that the Cigna network is one of the largest, if not the largest network out in the country today. So as far as being able to have a provider or doctor in the network, you should be taken care of well. And it's always updated on a weekly basis. So it's definitely something that we feel strongly that we put you definitely in the right spot. To start off with, one of the things that we do need to make you know or noted is that we are going to be talking about the benefits in network. Okay, if you go through the in-network doctor or physician, we are going to base ourselves off the two particular plans that you have available to you. One being the standard plan, and the second being the deluxe plan. If you look at each column, if you notice, every single line is exactly identical on the standard or deluxe, with the exception of the deductible section portion of the policy. On the standard plan, you have a $5,000 deductible, and on the deluxe plan, you have a $1,500 deductible. So, in taking into consideration, if you look where it says 3X family, you do have to take into consideration if you are enrolling employee and family, and you have, let's say, 3 members of the family, a husband, a wife, and a child, let's say, each person would have to reach the $5,000 deductible within a 12-month calendar year, and at that point in time, your co-insurance would kick in for every dollar afterwards on an 80-20 co-insurance. Okay, but for purposes of simplicity, what we'll do is we'll base the presentation off of one individual, just an employee only, at this present time. If you look at the standard plan, the $5,000 deductible per calendar year is what you would have to meet. Once you meet the $5,000 deductible as an employee only, then every dollar afterwards you'd have a 20% co-insurance, which means that the company, Cigna or Great West, would be picking up 80% of the tab, and you would be responsible for 20%. Now, you may wonder, well, what happens if my bill happens to be $15,000, $20,000, $30,000 on my on my coinsurance? I mean, is that what I have to pay? If you look right below that, it says coinsurance max per calendar year. And this is extremely important, and we designed the plan specifically to put caps in here to make sure that we protect everybody, because a lot of you are basically on a fixed income or on a salary, if you will. And so if you look at, based on an individual employee only, if you take the annual deductible, $5,000, and then you take the coinsurance max, which is $4,000, the total 100% out of pocket that you would be responsible for in a total catastrophe, saying that you had a major accident, you went to the hospital, and you've been really just bed rest, for some time now in the hospital, and the bills start tacking on, you would only be responsible for $9,000, which is a total of the $5,000 annual deductible and the $4,000 max, and every dollar after that, the company would pay 100%. Okay? That is extremely important for you to understand. You have to meet your deductible first, then your coinsurance max for the company to pick up 100% of the tab. All right? Now, in addition to that, right below that you see preventive care. Now, preventive care is something that through health reform, I believe it's on October 1st of 2010, where they've added this to where before you had to pay a coinsurance or you'd have to pay a fee, if you will. That has completely changed through their health reform. Now, as of October 1st of 2010, preventive care is going to be paid up at 100%. Now, some of you may be asking, what is preventive care? For females, it may be just a regular annual checkup, wellness checkup. For children, when you do your annual physicals, anything that is considered a preventive care is going to be something that would be picked up at 100%. Now, below that, you'll see also office visits. Office visits would be at a $30 copay for a particular office visits, and urgent care visits, which, for example, would be like your local hospitals in your neighborhood. They're just miniaturized hospitals that you can go to rather than going to an emergency room like St. Luke's, Ben Taub, or whatnot, and you would have a $75 copay. Versus going to an emergency room where you would have to pay a $300 copay, and then obviously subject to your deductible if you met it, then your 80/20 coinsurance would then kick in. But that is really important. I do want to make sure that you understand that some of the urgent cares in today's market have been bought out by the larger hospitals. So you may want to take into consideration by visiting some of those hospitals and verifying if they are part of that major hospital or if they're independently owned, to where you can qualify for that $75 copay versus a $300 copay if you go to an emergency room. That's definitely an avenue you want to make sure you look into, because it definitely is a big difference in relation to savings of what you would have to pay. Now, in relation to outpatient lab and x-rays, you subject to a deductible. Once you meet your deductible, you are basically would be responsible up to 20% of the coinsurance. Same goes with the outpatient surgeries. Once you meet your deductible, you have your 20% coinsurance at that point in time. Again, take into consideration, you also have your coinsurance max that will apply to it once you reach your $4,000. Inpatient care is also subject to meeting your deductible and then a 20% coinsurance, which is what you would be responsible for. The company pick up 80%. On prescription drugs, you have a $15 generic fee that you would have to pay for your generic drugs. If it's a name brand drug, you are subject to a $40 copay. And if it's a specialty drug, then it would be at a $70 copay. Now, please understand that when it's a specialty drug, if you're wondering what that is, you can definitely go to mygreatwest.com. They had web portals to be able to answer any questions you may have. And obviously, if you can't find the answer, we'll definitely try to assist you with that as convenient as possible for you. You are accessible to our email or to our telephone numbers at any point in time. Now, mind you, I do want to make you aware that if you go through the website, through mygreatwest.com, you also have the capabilities of going to mail order drugs, which is at a minimum of a 90-day supply, and you have substantial discounts that you can go from there. You can get from there, I should say. So just keep that in mind as we go along. So what we'll do is we'll go ahead to the following slide. In this particular slide, what you'll see is the biweekly rates for the plan. You have the standard and then the deluxe plan, broken down from employee only, employee spouse only, employee children only, or just a full-blown family plan on both the deluxe and standard. Now, you have to take into consideration that the employee contribution is, the numbers we have there is a proposed number. They were the original numbers that we were quoted from the very beginning. This does not take into consideration the final numbers once MyFit Foods contributes funds towards your medical bills, or I should say medical plans. In addition to the fact that all your options for medical-wise is going to be paid out at pre-tax dollars, which obviously gives you tax savings as well, and your net check would, in essence, be a little higher as well. Please take that into consideration. Once we do get final numbers, when everybody in the company, employee-wise, has turned in their enrollment form, and we have a true census of preconditions, medications, or whatnot, we'll be able to have a fixed number, and we'll go from there. But if you have further questions, you can definitely contact your HR department, and they'll be able to guide you to the right answer for that.